Om Shri Sai Ram. I offer my humble pranams at the lotus feet of Bhagwan Shri Sathya Sai Baba. The topic of our monthly webinar tonight is growing up with congenital heart disease and will be presented by Dr. Shivani Aggarwal, consultant cardiologist. Dr. Shivani Aggarwal was blessed to come into the Sai fold at the age of 7 while living in the UK. As per Bhagwan's directions, her family relocated to India soon after, and she went to Swami school in Delhi and then in Puttaparthi when her parents moved to the ashram. After completing medical school as per Swami's directions, she moved to the US in 2007 and pursued further training in internal medicine, cardiology, and then adult congenital heart disease. Throughout this course, Dr. Aggarwal has had this opportunity to serve in different capacities, such as teaching EHV, coordinating interfaith service activities, and serving as the young adult rep in centers across the US. She served as the regional young adult representative for Region 3 USA before she moved to Boston to pursue an advanced fellowship at Harvard. For the last 3 years, Dr. Aggarwal has worked as a consultant cardiologist specializing in adult congenital heart disease and cardiac imaging at Texas Children's Hospital in Houston and has just relocated in the UK to be closer to her family. Jai Sai Ram.
Om Sai Ram. Humble and loving pranams, dearest Swami. Sai Ram, everyone. It's my great pleasure today to talk to you about growing up with congenital heart disease and the prevention of acquired heart disease. So an overview of what we're going to talk about today. We're going to talk about the basics of congenital heart disease, including what it is, how prevalent it is, how it is detected, an overview of treatment for these conditions, what the lifelong effects of being born with heart disease are, the unique challenges that we face in caring for patients with this sort of heart disease throughout their life, special considerations for these patients with heart disease in pregnancy, and prevention of acquired heart disease. And I'm going to share with you practical tips for a heart-healthy lifestyle for everyone. So let's first understand, what is congenital heart disease? Congenital heart disease is a defect which develops in a baby's heart while the baby is still in the womb, before a baby is born. It is an abnormality of any part of the heart, any structure of the heart, such as missing parts, holes, extra partitions, abnormal connections. It can be anything. But before we understand more about congenital heart disease, we have to understand how the normal heart works. So the normal heart consists of two sides. It has a right side and a left side. The right side here is shown in this purplish blue, and the left side is shown in red. And what do these sides of the heart do? So what we call blue blood, which is really deoxygenated blood, so the organs of the body use up the oxygen, and then we get this deoxygenated blood, which is returned to the right side of the heart in this right top collecting chamber, crosses through a valve to the right pumping chamber, and this chamber then pumps out that blue blood through another valve to the lungs. And the lungs do their job of gas exchange carbon dioxide for oxygen. And so the blood is now oxygenated, nice oxygenated red blood, which comes back to the left top chamber of the heart, the left side, crosses through another valve into the left bottom chamber, and then from there is pumped out through this big blood vessel called the aorta to all of the organs of the body so they can all receive oxygen to function normally. So what happens in congenital heart disease? So we saw many different parts of the normal heart. If any of these parts is malformed, a child is born with a congenital heart defect. And there is a huge variety from very simple forms to sort of moderate complexity to complex to very complex forms of congenital heart disease. And we'll look at a few examples just to understand what sort of variety I'm talking about. So this is one of the simplest forms of congenital heart disease called an atrial septal defect. And it is a hole between the top two chambers of the heart, the top right and left chambers, which causes some mixing of the oxygenated and deoxygenated or the red and blue blood in the heart. This is a simple form of heart disease, sometimes doesn't even require fixing with small defects. We'll look at a slightly more complex form of heart disease. This is a disease called transposition of the great arteries. You remember we talked about this big blood vessel called the aorta, which supplies oxygenated blood to the body. This, instead of coming off of the left side, comes off the right side, and the artery which took the blood to the lungs, instead of coming off the right side, comes off the left side. So the two great arteries are exchanged and coming off the wrong sides of the heart. So obviously more complex than a hole in the heart. And then we'll look at one of the most complex forms of heart disease. Now, in this child, the left side of the heart is practically not formed. There's a small left bottom pumping chamber, maybe small or non-existent, really not functional. And even the aorta and the vessels which come off the left side of the heart are not very well formed. So this child is born with practically half of a functioning heart. And even though we do certain repairs to make this patient live and may even live to their 60s or longer, but they have a lot of complications later in life. So congenital heart defects, which a child is born with, even after repair, can have a lot of long-term complications. But what causes these congenital heart defects? Now, unfortunately, even though a lot of research is going into this, we often don't know the cause of these congenital heart defects. We assume that a lot of them are genetic and some we have evidence, but only a few congenital heart defects we've actually been able to link with certain genes. So what's more likely is that it's a combination of both these genetic reasons for congenital heart disease and then certain environmental reasons, which are even reasons which we may be able to modify. For example, women with obesity or diabetes are more likely to have a child born with a congenital heart defect. If a mother is exposed to certain toxins, such as cigarette smoke, alcohol, certain medications, if a mother has certain dietary deficiencies, or develops an infection during pregnancy, all of these increase the risk for having a child born with congenital heart disease. Now, we know that if there's a genetic cause for congenital heart disease, you're likely to pass it on to your child. But if your congenital heart disease was due to an environmental factor, then the risk of transmitting it to a child may be much lower. So how do we detect congenital heart disease and when? Now, detection of congenital heart disease can be done at any stage of a person's life. So it can be as early as when a child is still in the mother's womb, where we may be able to detect that they have a heart defect. It may be in sort of more severe forms of congenital heart disease detected in the first few minutes, hours to first few days of life. It may be detected in childhood. It may go undetected until the adult life. In women, oftentimes when they get pregnant and their heart has to do all that extra work to support a baby, then we may detect certain heart diseases. But certain heart diseases may even be detected in older age and occasionally may remain undetected and be found at autopsy. But how do we detect congenital heart disease? So here is a routine screening ultrasound of a fetus still inside the mother's womb, which every woman who gets routine prenatal care gets. And you can see here this little beating organ In the center is the baby's heart. Now, if on a routine screening ultrasound we suspect that the baby may have congenital heart disease, or if we know that the fetus is for some reason at a higher risk of congenital heart disease, then we do something called a fetal echo, which is when we look at a baby's heart in more detail while the baby is still in utero. And you can see here we can get excellent pictures of a fetus's heart and detect a multitude of congenital heart diseases before a baby is born. The other way which congenital heart diseases may be detected may be on routine examinations. So you take your child for the routine child visits to their pediatrician, and on exam they may detect a murmur or some other examination findings which may be concerning for congenital heart disease. Oftentimes in babies, actually the majority of murmurs are normal, but some murmurs may be associated with congenital heart disease. And then the other reason we may detect congenital heart disease is when someone starts to develop symptoms. For example, a child has difficulty breathing or other symptoms even in adulthood. When congenital heart disease is detected, it's usually through symptoms. Now, what sort of symptoms are these? Babies are not able to often tell us when they have certain symptoms. So how do we detect or think that a baby may have congenital heart disease? The baby may not be growing well. The baby may have like a bluish tinge to their lips or to their fingertips. They may have puffy hands or feet or belly or face. They may be extremely irritable and inconsolable despite doing everything, feeding, cleaning, everything. They're still inconsolable. They're not curious, not playful like babies usually are. Or they get tired very easily. They don't feed. They fall asleep right as soon as they start feeding. Or they're trying to feed and they're working so hard that they sweat excessively while feeding. Or for some reason the baby is just getting fatigued very easily. The baby has a rapid heartbeat. Any of these, and especially if a baby has multiple symptoms, they may be suggestive of congenital heart disease, and you should ask the pediatrician to evaluate them. Now, sometimes these symptoms may occur in adulthood. Not the same symptoms, but the very subtle symptoms. For example, someone isn't able to function to the same level as a normal person in their age group would function. Or, the patient is a little more short of breath than is normal for doing something. And confusing because it may just be because they're not active, but could be due to congenital heart disease. So very subtle symptoms, and oftentimes people have had the symptoms for so long they don't even know they're having symptoms. But in adults, there may be very subtle symptoms which can lead to a diagnosis of congenital heart disease. How do we treat congenital heart disease once it is detected? Now, of course, we talked about the wide spectrum of diseases. So there is also a wide spectrum of treatment. Some may be very benign, like small holes in the heart. Some can close on their own. Some are so small that they hardly cause much mixing of blood and don't cause long-term complications. So we just need to sort of observe every so often, go have your heart checked, but don't require treatment. Some may be treated with medications. Some are detected early in very severe forms of congenital heart disease, so may require treatment while inside the mother's womb. Very advanced, very few treatments can be done inside the mother's womb, but it is potential. Some may be treated through interventions in the cath lab. Some may require open heart surgery, and some very severe forms of congenital heart disease may even require heart transplantation. So there is a huge spectrum of treatment based on the condition and its severity. And what happens when a child is born with congenital heart defect and treated? So about 1 in 100 babies is born with congenital heart defects. Now, the good news nowadays is that over 90% of these babies born with congenital heart disease actually survive to adulthood. Now, this brings us to my favorite topic, adult congenital heart disease. And let's see how the prevalence of congenital heart disease in the adult population has increased over time. Now, a few decades ago in the 1950s, only about 15% of babies born with congenital heart disease actually survived to adulthood. Now, however, we said more than 90% of those born with congenital heart disease do survive. So you can see here in the early 2000s, not so long ago, this is in orange, you can see the number of adults with congenital heart disease, and in yellow, the number of children with congenital heart disease. And you can see there were less adults surviving with congenital heart disease compared to children. Now, the prevalence in children has remained the same, but in adults, because more are surviving, the prevalence of congenital heart disease is increasing with time. So around the time of 2012 to 2013, the prevalence of congenital heart disease in the adult population actually exceeded the prevalence in children. So now we have many, many more adults with congenital heart disease in the population than we have children with congenital heart disease. So this is not just a problem for children. This is a huge problem in the adult population. Congenital heart disease in adults is a lifelong condition. So they may in childhood need repeated operations or interventions. Sometimes they are hospitalized for months together. Sometimes they require emergency admissions, and they may require repeated surgeries throughout their life. They may live with certain symptoms like not being able to exercise, reduced quality of life, depressive symptoms. They may have complications, such as complications in pregnancy. And then they develop the problems which other adults do, like high blood pressure, but then they also have higher risk for heart diseases like rhythm problems because they have artificial material in their hearts. They may develop infections in the heart called endocarditis. They are often on lifelong therapy. They can die suddenly, and then they have complications in other systems. Additionally, they go on to develop heart disease, which all of us are at risk of developing as we grow older. And so overall, they have reduced life expectancy, and congenital heart disease is not something you're just born with. It's something which you struggle with throughout your life. What sort of long-term challenges can a person face when they are born with congenital heart disease? So they may have been born with a misconnected artery, and that surgically that artery was switched and a repair was done and they're living normally, but the valve inside that artery has become leaky over time, so they can develop heart valve problems. They have all this little stitching in their heart, and that stitching can lead to later in life heart rhythm problems. The heart function can go down over time because it's working harder, or the wrong chamber is working on the wrong side of the heart, and they can develop heart failure over time. We talked about artificial material used in surgical repairs which can get infected, most of the infections which come from the mouth and go into the bloodstream. But then they also develop complications in other systems, like they can develop high pressure in the lungs, which is a very dangerous disease. They can develop neurologic problems, strokes, they can develop liver disease, they can develop kidney disease. So there are a lot of long-term challenges which patients born with congenital heart disease may face throughout their life. Another big issue, often underappreciated, is the psychological and social aspects of congenital heart disease or living with congenital heart disease bring. Now, psychological difficulties come with I've had patients who tell me that, they remember this sort of trauma which they had when they were maybe a few months or few years of life and went through open heart surgery. I can't imagine, remembering something from that age. But these patients sometimes remember that, and they sort of have this post-traumatic stress associated with all the care that they have had, or the complications that they have had during their lifetime. Also, they may have for a long time not had enough blood going to their brain because, of course, every organ is dependent on the heart. So they may have some neurocognitive defects from the disease itself, or from undergoing these long surgeries on their heart. But then they also struggle with multiple frequent visits to the doctor, multiple hospitalizations, which has a big psychological strain on these children. They may be, behind their peers, both physically and mentally, which also causes a lot of problems for them. They may be behind their peers in terms of their educational abilities and achievement, but also attendance because of so much medical care. And though many times these people are very resilient, they also struggle. They have much more depression and anxiety, which we need to take care of when we treat a person as a whole, and take care of them as a whole. There are also a lot of social factors which these patients have and need to be taken into consideration. For example, like treatment of congenital heart disease, we have 10 tertiary care centres in the entire UK for adult congenital heart disease. So patients may have to travel very far, and they may have social limitations to, getting the optimal care. So there are a lot of social aspects. They oftentimes struggle to get appointments on time. The NHS has, there are fewer specialists in adult congenital heart disease, so NHS is struggling to take care of the huge growing population with fewer providers. And then as these children age and transition to adulthood, they face a lot of challenges. They had educational challenges, but then they have employment challenges. They have challenges in family planning. So there are a lot of challenges which they face at this transition period. They may not take as good care of themselves as adults as their parents did when they were children. So the transition from pediatric care to adult care can be very difficult. So this is sort of an overview of the psychosocial aspects of growing up with congenital heart disease. But how does one with congenital heart disease live well? So if you have congenital heart disease, it is extremely important for you to understand your heart defect. You must meet with a heart specialist, a congenital heart specialist, when reaching adulthood. You must understand your defect by asking questions. Ask questions so that you understand your defect. Ask if it is safe for you to get pregnant and what the risks are if you get pregnant. Even if you don't have any symptoms, keep your follow-up appointments, even if you are feeling well, because we need to detect complications early so that they can be managed before they cause irreparable damage. Seek emotional support as needed. Know your treatment options, and then very importantly, maintain regular dental care. Otherwise, you put yourself at risk for infections in the heart. What are the other effects on day-to-day life? Congenital heart disease has a multitude of effects. If you're taking medications, both in terms of, the practicality of taking medications multiple times a day and remembering to take medications so that you don't develop further complications, but also the side effects of medications. And then how do medications for other diseases, or how do other diseases interact with your congenital heart disease? How can they be treated? Do we need to take different precautions while treating them because of the underlying heart disease? Getting regular dental care. Actually, every 6 months it's advisable for them to get dental checkups if they're at risk of infections in the heart. How about getting active? They have to know what is safe in terms of physical exertion, and how they can safely be more active to prevent other forms of disease. Sometimes they have a lot of dietary restrictions which affect their day-to-day life. And then things like smoking, drugs, and alcohol can affect them in more adverse ways than the general population. Their congenital heart disease may affect their relationships. And then hugely in women, congenital heart disease or any form of heart disease which has come in the childbearing age can affect pregnancy. So let's talk a little bit about how heart disease affects pregnancy. So here is a chart which shows you how deaths during pregnancy have changed over time. So you can see with improving care over multiple years, the death rate during pregnancy has come down. But unfortunately, in more recent years, the deaths during pregnancy has actually increased. So what is the cause for deaths during pregnancy? Why do we see an increasing trend in deaths during pregnancy? So this is one of the more recent census on what the causes of death during pregnancy are. And here you will see that the largest number of deaths during pregnancy are caused due to cardiovascular disease. Either it's directly related to the heart or, like clots in the blood vessels or blood pressure issues during pregnancy. They all cause risk of death during pregnancy. So what must someone understand about their heart disease if they desire to get pregnant? There is a common misconception that people with heart disease cannot get pregnant, and we need to understand that the majority of people with heart disease can actually have a successful pregnancy. Now, these are the different risk categories, and of course you don't need to understand all the different types of heart disease, but every heart disease, depending on the disease, its severity, what the heart function is, a multitude of factors, can be categorized as a certain amount of risk during pregnancy. So the majority of diseases fall in these risk categories from 1 to 3, where they can get pregnant and they can safely get pregnant and deliver, but with different amounts of care during pregnancy. A smaller number of diseases are in that category of risk where we actually advise them not to get pregnant because it's very dangerous and almost like 50% mortality rate even if they were to get pregnant. So people with heart disease who are in the reproductive age group and would like to pursue pregnancy must understand before they pursue pregnancy what their risk is and what they can do to reduce their risk both to themselves and to the baby to have a successful pregnancy. What about the risks to the baby if a mother or even if a father has heart disease? So there's a significant variability. In general, if one of the parents has congenital heart disease, there's somewhere between a 3 to actually 7% risk of heart disease. Slightly higher if the mum has it than if the dad does, but there is a high variability. Certain heart diseases, which are due to genetic syndromes, can have as high as a 50% risk of a child being born with heart disease. And then others, it's much lower. But there are other risks, such as the child being born small, being born premature, a lot of other risks too in the child, risks of child bleeding, if the mother has heart disease. So these risks are also important to understand before pursuing pregnancy if you have heart disease. So what we strongly advocate is that anyone who has known heart disease and is contemplating pregnancy should consult with an obstetric cardiologist prior to getting pregnancy. That's called preconception counseling, to understand the risks specific to their heart disease and decide accordingly both whether they want to get pregnant and how they need to be cared for during their pregnancy. So it's very important for anyone with heart disease to have a planned pregnancy. They also need to understand what sort of contraception can be used if they have heart disease, because certain forms of contraception are contraindicated in people with certain heart disease due to like increased risk of blood clots. So one must understand all of this to be able to make an informed decision regarding pregnancy if they have heart disease. So once someone has congenital heart disease or has developed heart disease in childhood, we recommend that we do everything possible to prevent development of additional heart diseases during their life. This portion of the talk is applicable to everyone for prevention of heart disease, as heart disease is the leading cause of death globally, and the majority of these heart diseases which people die from are acquired. That is, the heart disease is not one which someone is born with, but something which one acquires over their lifetime. So let's look at what we can do to minimize our risk of heart disease. So I like to talk to people about life's essential 8s, just 8 things which we need to take care of to reduce one's risk of developing heart disease. One is to eat better, to be more active, to quit tobacco, to get healthy amount of sleep, to control your cholesterol, to manage your weight, to manage your blood sugar, and to manage your blood pressure. So these are life's essential 8s to manage and to minimize your risk of heart disease in the future. Let's look at all of these in more detail. This is the Eat Well guide from the UK government. So you can see that the biggest proportion in our diet should be that of fruits and vegetables. And then grains, another large portion of our diet, should be more fiber-based or whole grain. We should try and get our proteins from sources like lentils, beans, and then a smaller amount of dairy, minimal amount of healthy fats, and avoid these, what we all love, sort of tasty junk food, getting an optimal amount of water. So there's a lot of controversy about what's good for your diet. So I'd like to just suggest a few simple rules to follow to eat a heart-healthy diet. Adopt a more plant and less animal-based diet. Consume 5 portions of fruits and vegetables a day. You may think 5 portions is not that difficult, but 1 portion is about 1 cup of fruits and vegetables, or a sort of larger sized fruit like a large apple, a banana, larger sized fruit, or a cup of fruits and vegetables. 5 a day can be pretty hard to get in your diet. Consume a diet which is high in fiber, and your grains, try to consume whole grains. Consume healthy fats, which are actually protective against heart disease, like the fats which come from nuts, avocado, olive oil. Try to consume healthy fats. Minimize the calories from sugar. Carbohydrate and, simple sugar calories are the worst form of calories. Eat more beans and pulses. Avoid red meats as a form of protein. Just remember, natural is better. Avoid processed foods, especially things like hydrogenated oils. Avoid too much salt. Avoid too much sugar. Avoid unhealthy fat. So then coming to the second essential 8, exercise. So we recommend each week we should get at least 150 to 300 minutes of moderate intensity exercise, or 75 to 150 minutes of vigorous exercise. What constitutes moderate exercise? Brisk walking, cycling, water aerobics. More vigorous exercise, running, swimming laps, intense dancing, jumping rope. So you can also have a mixture, some moderate and some vigorous exercise, combination of the two. In addition to this, you should do some sort of resistance or weight training at least 2 times a week. And then other principles which help you get enough exercise: just sit less, walk more. If you're parking your car, try and park it the furthest parking space away from where you're going, so you walk more. Take the stairs instead of taking the lift. And then as you're exercising, try to add intensity over time, so you are getting more exercise, which we know is healthy in preventing heart disease. What about for children and teenagers? Every child or teenager should get at least an hour of physical activity every day, including their playtime, structured activities, at least 60 minutes. Coming to our third essential 8. Now things have improved in general over time, but of course we need to quit smoking. What people don't understand is that, everyone knows that smoking is bad for you, it causes lung cancer, but that's not the only harm. Smoking doubles the risk of having a heart attack. Smoking increases your blood pressure. It causes increased risk of having a stroke. It increases risk of not just lung cancer, but mouth and throat and stomach cancer. It reduces fertility in both men and women. It can cause weak bones. It causes premature aging of the skin. So smoking has a huge number of effects. And the good thing is, there are hundreds of resources to help us quit smoking. The government, the healthcare system, they are very invested in helping people to quit smoking. So if anyone needs to quit smoking, just ask. You have a multitude of resources to help you quit smoking, and it's extremely harmful for the heart. Let's go to our fourth essential 8. And this was added more recently. It's a good thing that, the cardiovascular community is now getting to understand the importance of healthy sleep. How much sleep? For adults, on average, about 8 hours of sleep a night is a healthy amount of sleep. Babies and kids, they need more. If you don't get enough sleep, it puts you at risk of heart disease. It puts you at risk of dementia, depression, obesity, high blood pressure, worse blood sugar and blood cholesterol. So extremely important to get healthy sleep. It helps in healing, getting stronger, improved immunity, better brain function, and then less risk of multiple chronic diseases if you get healthy sleep. What can you do to help you get more healthy sleep? We have all these devices which oftentimes interfere, and I'm as guilty as everyone else in getting enough sleep. But we can actually use these devices to help us get sleep. So we can set alarms not just for waking up, but set an alarm to remind you that it's time to go to bed or wrap up for the night. Dim your screen so that you don't get as much blue light, which can mess up your sleep. Move your device as far away from you as possible when you're sleeping, so that you may also feel actually less overwhelmed if you do that. Lock your device. There's a lot of apps which can help you sort of block certain things which you use. So try not to keep scrolling through it. And then use like a do not disturb at night so that you're not getting constantly disturbed by your phone and spoiling your sleep. So coming to the fifth essential 8, manage your weight. So a BMI, a body mass index, which is a ratio of your weight for height, of over 25 is considered overweight. This chart shows you the percentage of Indians overweight, which is increasing over time. Now, though the WHO defines overweight as a BMI of over 25, because South Asians are prone to central obesity, where they have more fat on the abdomen, a BMI of over 23 is actually considered by most as overweight now. So that was an underestimate of the percentage of Indians who are overweight. How do you control your weight? Know what your BMI is. Keep track of your calories in and out. Control your portion sizes. And then, like we talked about, eat smart, get active, and ask for help if you're struggling to manage your weight. What is cholesterol? Our sixth essential 8, cholesterol, is a fat-like substance that comes from both your food and your body. and it can accumulate in your blood vessels and cause heart attacks and strokes. What must you do to control your cholesterol? Cholesterol needs to be checked for every adult. You must know what your bad cholesterol is and what your good cholesterol is, which actually protects you from heart disease. A bad cholesterol should be managed and should be kept under 3, and good cholesterol should be kept at about 1.4. So what can you do to control your cholesterol? We talked about all these dietary interventions. That, along with exercise, are things which you can do to control your cholesterol, and other things you can work with your physician, for example, if you need medications to control your cholesterol. Coming to our 7th essential aid, manage your blood sugar. Everyone should also be screened for diabetes. The 2 values to know are your fasting blood sugar should be less than 5.5 millimoles per liter, and your hemoglobin A1C, which looks at your blood sugar over, say, the last 3 months, should be less than 6%. Any values over these are either pre-diabetes or diabetes, and if these are, you work on your diet and work with your physician to optimize your blood sugar. Coming to our last essential 8, manage your blood pressure. In order to manage your blood pressure, first understand your blood pressure. It is the pressure in your arteries which carry blood from your heart to all of your body. And if your blood pressure is high, it leads to that same buildup of plaque which can cause heart attacks. So many people, because if you have high blood pressure, it doesn't necessarily cause you symptoms. You could be walking around with high blood pressure, which can kill you without even knowing it. So make sure you have your blood pressure tested or test it yourself, and then work on the same things which we had talked about to reduce your blood pressure. Avoid smoking, work on your exercise, work on your weight, avoid salty foods, avoid drinking too much alcohol, be more active, eat more fruits. All of this can help you manage your blood pressure. And then, of course, you have to work with your physician to lower your blood pressure to an optimal level. Normal blood pressure should be pretty much 120/80 or below. All right, so here I've just put a few good resources for you to learn more about both congenital heart disease and prevention of acquired heart disease from British Heart Foundation, American Heart Association, Adult Congenital Heart Association, and then the NHS and government websites. In conclusion, congenital heart disease develops in the womb and is a lifelong disease. People with congenital heart disease have challenges throughout their life. We talked about the importance of longitudinal follow-up and how cardiac disease is the leading cause of maternal mortality, so one must understand the risks before getting pregnant if one has heart disease. And then finally, we talked about the essential 8 for prevention of acquired heart disease. And to conclude, here are finally our beloved Swami's words, who always taught by example. Embodiments of love. How to lead a healthy life. Let me tell you about my own health. I am 68 years old, and believe it or not, my weight since my 14th year of age has been constant at only 108 pounds. It never went up to 109 pounds, nor came down to 107. You can lead a healthy life once you achieve this kind of balance and moderation. I never eat even a little bit excess. I observe the principle of moderation, whether I am invited for food by a millionaire or a pauper. Even though I am 68 years, my body is in perfect trim. I do not suffer from aches, and my heart is as sound as a rock. There is no one who can work like I do and exert himself as much as I do. The secret of my sound health is my regulated food habits. This is how one has to achieve the unity and harmony of food, head, and God. Jai Sai Ram, and thank you.
Thank you very much, Dr. Aggarwal, for a very, very useful and very informative topic discussion and presentation today. We got a bonus because you didn't not only just talked about congenital heart disease, but you gave us some very good tips about healthy living and what to do to keep ourselves fit and well. There are one or two questions that have come up, and I will start off with a simpler one. Uh, Somebody has asked that they often see footballers or long distance runners suddenly drop dead in the middle of whatever they're doing. And they're usually quite fit people, otherwise, they won't be doing what they were doing. What is the reason for this one? And is there a congenital heart disease that manifests itself for when this suddenly happens? And can it be prevented in any way?
Yes, so definitely some of these people do have a defect, sort of either a congenital heart defect, which can cause the majority of people who die suddenly die because of some sort of rhythm problem. So it may be like there's a disease where the heart muscle becomes very thick, and then it can develop sort of disorders of the rhythm, and those can cause people to die suddenly. So unfortunately, a lot of these are, detected too late. But some of them, have a genetic component. So if there is someone in the family who has some sort of heart condition, and it's if we know that it's something which can be inherited, then people, the relatives definitely should get checked up. And I think that's something which sometimes isn't taken care of as well, is screening of family members when someone does have that sort of heart disease. And if someone does develop symptoms when exercising, then that can be sort of a precursor to, the realization that someone has heart disease. So symptoms which come on with exercise, definitely I recommend those are investigated. And you see your GP, talk to them, and they can refer you on to a cardiologist if they're concerned about the symptoms. So definitely some of them they're not, a lot of them are not sort of structural defects in sort of the pumping or the valves, but they can be in sort of I talk of them sometimes as like wires which go through the heart, which start your heartbeat, and the electrical activity of the heart, which can be abnormal, which can cause some of these people to die suddenly.
Okay, so the essential thing is that it cannot be picked up. So prevention-wise, there's nothing we can do to say get it checked or anything like that. But the important thing is to make sure that if anybody has family member with this particular problem, they really all must get checked.
Absolutely, yes, yes.
Thank you very much. And the other question that came across was that you mentioned that in babies and children, quite often there are no symptoms of congenital heart disease. Will this be get picked up at 6-week check or 3-month check or routine check that they should have? And it is very important for them to get these checks done. Is that right?
Yes, absolutely. It is very important to get the routine checks because some things are very subtle. Obviously, if you have a child who has a murmur, you don't know until someone has listened to their heart, and then they can sort of detect other simple things. Are they gaining the right amount of weight? When you go for your routine checkup, they will compare the child's growth, both height and weight, to the general population. And if there are any concerns about that, that could be a sort of more subtle finding, which can indicate that there could be some congenital heart disease. So even if there are absolutely no symptoms, it is very, very important to get your routine health care. And there's a reason why, after a lot of data, they have recommended that a child be checked every so often. And that is to detect not only heart disease, but other diseases too, which can be more subtle. So yes, definitely get your routine care.
You mentioned that it's not that it doesn't look that common. If there's 1 in 100 patients 1 in 100 people have congenital heart disease, and of those 90% survive and with good results. So it's not that common, it looks like. But is it the same case all over the world, or is it just in England and in the Western world?
So there is some variation. So there are studies, in Asia, in the Western world, in Africa. So there's some variation, and there are also, multiple studies in one area. So I'd say about somewhere between like 8 in 1,000 to 1 in 100, so 0.8 to 1 per 100 is sort of a rough estimate globally of what the prevalence is of a child being born with congenital heart disease. And this doesn't necessarily include every little heart defect. This is sort of comprises the majority of congenital heart diseases. But then there are also other heart diseases which can develop in childhood, which also, sort of come into this category of, living with heart disease as a child.
And the survival rate, is it quite good in other countries as well as here, or is it not that?
Yeah, that is variable. I think, yes, there are some, for example, one of the heart conditions which I had described where, you're born with practically half of a heart. And there is a lot of variation in how much they would do for that child in sort of the more developed countries versus that child in, an underdeveloped or developing country. And also things like heart transplantation, you don't have access to all of that the same way everywhere. So there is a lot of variability in whether all of these people survive. But I would say, for example, in India, they have the majority of more complex surgeries, interventions which can be done are done very well, and the majority of patients, over 90%, do still survive to adulthood. And then there are places where you don't have access, where people can go somewhere where there's more access. I know that, in some places like in Africa, per se, they have, a lot of charitable services. People come over and as they accumulate the patients, and then people will go and do multiple interventions and sort of like medical camps. But treated, yes, the survival is great. It's over 90%.
Brilliant. Can you tell us something about the super specialty hospitals in India that treat the congenital heart disease for free? And I think there's one in Jaipur, but tell us a little bit more about how many there are and what sort of things they do.
Yes, so of course, Swami has his two super specialty hospitals, one in Whitefield and one in Puttaparthi, which they both do amazing work. They do some very, very complex congenital heart surgeries. And I actually had the good fortune of being there, just towards the end of last year, beginning of this year. They see very unique, rare cases because of, being able to provide that care completely for free. So they have people coming from all over India to seeking that sort of care. They do open heart surgeries for babies, sometimes a few days old. And then they also see people who have not been repaired in childhood. So we had many even teenagers with congenital heart conditions, which here they would have had a surgery probably within the first few months to first few years of life, but they're getting similar repair and probably good outcomes, maybe not to the same extent, but still very good outcomes even when they're repaired later in life. Of course, there's some selection, some conditions are severe enough that if they're people who have survived to adulthood have sort of a better balanced heart condition to make it to adulthood without repair. But yes, they're doing amazing work.
Thank you very much. And in England, it seems that because the investigations are quite costly and referrals are quite costly, sometimes the GPs are not too keen to refer you on. Are there any tricks that we can, or any information we can give the GPs to make the referral a little bit quicker or more important or, urgent?
Yeah, so I would say, I'm sure they're doing their very best in referring, but I would be very thorough. I think, sometimes we hesitate knowing how busy people are, but I would be very thorough in talking about what symptoms or what your concerns are. And I know most of them, they all do care enough that if you have concerns, either they don't think that it's really concerning enough to be investigated, or it's something which is not necessarily. For example, it may be many times someone comes and tells me, okay, I'm very short of breath when I do this. And then if you dig a little more into the history, you see that they just haven't been active forever. And so you would first encourage them to try and be a little more active. And then many people, when you encourage them to be more active, they realize that their, shortness of breath is actually getting better when they actually try to be more active, versus someone who is very active and then finds that they're not able to do what they were previously able to do. So there's a difference, but I think you should just be very thorough in describing your symptoms, so that they can make the right judgment call about whether they need to check it. And if they don't and you're still having symptoms, I would go back again, make a repeat appointment, persist if you feel like you're having more than what they think you have in terms of symptoms.
So persistence with the GPs and explaining your symptoms a bit better is probably the best way forward. Now, this one is quite tough, this one. So I don't know how you're going to answer this one. Somebody wants to know, can you give them some tips about how to support people with congenital heart disease? What sort of things to say? What sort of things not to say? Whether to make them some exercises or whether to sympathize with them or what to do?
Yes, so that can be very difficult. I think it's important to sort of take a hint from the person. I've had patients who, are very proud of the scar on their chest. They're very willing to talk about it. They're willing to, even come into a public forum and talk about their heart disease, and the fact that they've survived through a lot of complications. And then I have some patients who are very sensitive. They always want to hide their scar. They're very private people. They don't want to talk about it. And I think that's absolutely fine either way. I think when we talk to someone who has congenital heart disease, or any disease for that matter, especially a chronic disease, which they've obviously is a big part of their life, I think we have to take the cue from them about, if they're willing to talk about it, then obviously, yes, ask them. Many times it's just listening more than giving advice, because they oftentimes do need someone to talk to. And then if they're willing to talk about it more, then I would say definitely encourage them to continue to seek care, because people sometimes don't take as good care of themselves as they should. The majority of people, even with sort of more complex congenital heart diseases, can exercise and sometimes don't realize that they should be exercising more. Some of them have been restricted as children and don't realize that they need to be more active to prevent heart disease in the future. But there are some restrictions, like very heavy weights, for example, or contact sports, for example, are things which they may be restricted from. So I think if they don't know what they can and can't do, then I would encourage them to talk to their cardiologist about, get good guidelines about what's safe for them. Encourage them to seek proper care is one of the big things, especially in adults, because they tend to be sometimes a little more casual about their health care. And then just support them. Oftentimes they need a lot of support. There's a lot of depression, a lot of anxiety, a lot of stress related to their heart condition. So they do often need a lot of support from friends and family. But take the cue from them about, sometimes you don't want to ask too many probing questions if they're not ready to talk about their condition.
So sympathy and support is probably the best thing to do.
Yeah.
Okay.
Absolutely.
Now, Indian patients and Asian patients particularly are very, very prone to diabetes. So
Yes.
can you tell us how much difference there is local people-wise and us about diabetes, and we should really be careful about our weight, etc. So if you can stress that point a little bit more and give us more information, that would be very helpful.
Yes, absolutely. So I think there's something about our genetics and about how we've sort of adapted to a more modern lifestyle, that we see that the prevalence of diabetes in our population per se is very, very high. And even weight-wise, we talked about the cutoffs for the upper limit of weight before you're called overweight is lower in people of South Asian descent. We tend to accumulate all of our fat sort of in the abdominal area, and that is an indication, how much fat you have in the abdominal area is actually an indication of more of the internal fat around your internal organs, which is what is, sort of dangerous, is accumulation of fat internally. And so I think because we know that our genetics, we're more prone to getting diabetes, we're more prone to getting heart disease. A lot of us are, we see a lot more people, especially men in their 30s, getting heart attacks. We see some even in their late 20s, very, very early on in life. So we have to be even more cautious than the general population about eating healthy, making sure we're keeping our weight under control, avoiding those empty calories, the sugars. We eat a lot of sweets, I think, in our community too. So trying to keep all of that under control, because lifestyle is the best way to prevent heart disease. We also actually tend to exercise less than the general population. It's just something in our community which we need to really work on, is getting a good amount of exercise. I think all of this is extremely important for our population.
Thank you very much. And should all Indian men and women get their blood sugar checked after the age of 30?
Absolutely, I would say yes. Screening can start earlier, even as an adulthood. Definitely by the age of 40, everyone should be screened. But even earlier, especially if you have family history, diabetes, especially type 2 diabetes, is something which there is a genetic component to it. So I would say yes, everyone needs to be screened.
So for the blood pressure, for the weight, and HbA1c if necessary, whatever. So they can get themselves checked out and sorted before anything goes. Thank you very much, Dr. Aggarwal. That was a very, very stimulating presentation that people found very helpful. Thank you, everyone, for attending the session and sparing time to listen to us. Thank you also to the IT team and Gayatri Ben for organizing the seminar. And above all, thanks to our beloved Sai Baba, without whose grace nothing ever happens. So, Sai Ram, and thank you very much for that. Our next session is going to be in September, because we are having a little short break of a couple of months, and we will let you know in good time what's going to happen, what's the topic for the next one. Sai Ram, all of you.
Yeah.